Good morning. My name is Dr. Priya Ramachandran. I am a pediatric surgeon and I have been practicing pediatric surgery in this hospital for the past 23 years. This hospital is unique because it was founded with a mission to serve the underprivileged children of society out of the scope of governmental organizations. Most freestanding children's hospitals all over the world are affiliated to universities or are run by government institutions because there is a popular perception that freestanding children's hospitals do not make money. This was not something that bothered the visionaries who were the founders of this organization. They cared more for lives than they did for money. This may sound romantic and overstated, but this happens to be the truth because the dream that brought forth this hospital was an ideal dream. They did not stop to think if this vision of theirs would be profitable. They just went ahead with doing what they thought was right and what they thought that society needed. At the time that this hospital was founded in 1979, the government hospital in the city was becoming overcrowded and its resources were stretched to the limits. And often, the doctors there felt that there was a need for another similar institution to help the children who could not be helped within the confines of the government institution. And so, the Child's Trust Hospital was founded to help children from middle and lower income groups and to provide them with the best medical care that money could buy. And it owes its existence largely to benefactors and philanthropists who believed in this vision and who donated large amounts of money. Because to be able to buy everything that money can buy, you need to have money in the first place. And so it has been a constant challenge to raise enough money to buy equipment and to provide world-class treatment to children who otherwise would not be able to afford it. This hospital partners with various NGOs and governmental organizations to provide free treatment for chronic illnesses like cardiac diseases and cancer. Scheme of the Tamil Nadu government supports children who need cardiac surgery in our hospital, and an NGO by the name of the Ray of Light Foundation supports children who need cancer treatment. But this is not enough. We need more and more philanthropists to come forward and support children who suffer from other chronic diseases involving the kidney, the neurological system, and the immune system. We also need equipment constantly to be upgraded and revitalized and maintained. Our doctors who work here with the mindset that we are here primarily to serve children. This is a far cry from doctors who work in the corporate sector. We do all that we can for our children, all that we can within our limits, and we look to others to provide what we cannot, which often is financial help to complete treatment and financial help to purchase equipment. The donor of this hospital was a pediatric surgeon himself, and today this pediatric surgery department is a tribute to him in that it is a center of excellence for teaching and training as well as for the complicated work that we do. The Department of Pediatric Surgery strives to offer the best surgical skill set to the patients who come seeking our help. Again, the Department of Pediatric Surgery, which comprises of 3 surgeons, deals with most pediatric surgical issues, including urological issues. And we also have specialists who take care of neurosurgery, cardiac surgery, orthopedic surgery, and ENT surgery. Now, let me tell you a little bit about the donors who have supported this hospital, starting from the very first donor who gave the largest amount of money at that time. The Rotary Clubs of Whitby, Canada were inspired by this dream, and under the 4H grant, they donated at that time an amount of rupees 4 crore, which was the seed money that started off this institution. From that point onwards, several companies have continued to contribute towards this cause. The Sanmar group of companies, the TAFE group of companies, the Rotary Clubs continue to support us, as do several other companies like the Sanmar Group, the M.A.M. Ramsamy Charitable Trust, the TAFE Group, and several private philanthropists. We also have received donations. We have also received significant contributions from public sector units like Neyveli Lignite Corporation and Rural Electrification Corporation, etc. The children who come to our hospital continue to stay with us even though they have to travel some distance to reach us. Most of our children come from the neighboring state of Andhra Pradesh. They seek us out because we are a center of excellence and we offer ethical medical treatment. Now, this is a big issue where patients suffer if ethics are compromised, and we never let our patients suffer. So, we look forward to adding you to the list of donors who have contributed to our cause. We invite you to believe in our dream. Thank you.